this rate cut will be hard for them to keep their doors open. We're looking at massive home health agency closures. If we lose that ability, families are going to be faced with either having to get that care somewhere else or just go without, because we're going to see an increase in rehospitalizations due to that, or even things more devastating.
Welcome to In Good Company, Elder Care in Your Backyard, the podcast that brings local perspective on aging, caregiving, and healthcare right to your ears. I'm John Ray.
And I'm Spencer Ernst. Every week we talk with the people on the front lines, all making elder care accessible to you. Carol Hudspeth is the executive director of the Missouri Alliance for Home Care, where she advocates for quality and sustainable in-home care across Missouri. With a career devoted to public service and nonprofit leadership, she works to strengthen consumer-directed services, empower individuals to live independently, and amplify the needs of seniors and the home care workforce through policy discussions and publications like the Missouri Independent. Her leadership focuses on advancing equity, supporting providers, and ensuring Missouri families have the resources to age with dignity. Carol, welcome to the show.
Well, thank you. I'm excited to be here today with both of you.
Well, we're excited to have you as well. We just recently sat down with Kim Sisk with Cox at Home. And, I early on, I've known Kim forever. And so I didn't know you guys crossed paths so much together. And so it was really fun to sit down with her. And after our conversation, it just made me really, really excited to sit down with you. But before we dive into too much, I just want to kind of check in on what exactly Missouri Alliance for Care at Home is and what your role is. And
just a shout out to Kim too. Kim is a wonderful person, a great colleague and friend. She is actually a current member of our board of directors. So she's a wealth of knowledge and a wonderful addition to our association. So just wanted to give her a shout out. We all love Kim. The Missouri Alliance for Care at Home, and we actually just rebranded in April. It was. We were the Missouri Alliance for Home Care, and to align better with our national association, who went through a rebrand and a merger, are now known by Missouri Alliance for Care at Home. So what we do, we are actually the largest trade association in Missouri dedicated to kind of representing and advocating the interest of home health, kind of the all gamuts of home care, home health, hospice, the Medicaid type programs, where it's going to be your personal care programs, non-skilled, the medically complex children programs, we call that private duty nursing. So that's kind of home care for your kiddos that, are on trachs, vents, that type of thing, need very medically complex cases that need extended nursing care. We also represent the private pay sector. So folks, home care agencies that don't necessarily take federal funding or state funding. It's strictly private pay. They don't have as many regulations and policies to jump through, but we represent those providers because they want to kind of stand out above the rest a little bit, be involved in the association to kind of set their bar a little higher.
Wow, that is a lot to cover. A lot of people you've got to help advocate for. Do you find that there being so many different angles that it's a lot to keep up with?
It is a lot. There's a lot of policy, a lot of regulation, things like that. I always, tell my members though, my respect is for them. You guys are the ones that are having to do boots on the ground, do the work, meet every regulation and policy, while still at the end of the day providing the best care you can. And that's not always an easy job. So yes, on my end, it is a lot to keep up with. But again, I have the utmost respect for our providers.
It must be a challenge sometimes to prioritize what you focus on the most or are able to put. Do you have a big staff that help you?
No, we don't. We actually, there's 3 of us total.
Oh, wow.
So there's me as the executive director, and then we have a director of events and education. So she takes care of our trainings, our annual conference we do every year, different educational trainings that are needed, and then kind of like a catch-all extra person that can help where needed, administrative type things. So yeah, just three of us here in the office. So and then I do have to say we have a great board of directors, though. They are a volunteer board. You know, we're a not-for-profit company, and without our board, you know, they do step up many times and help where needed.
Wow. So recently you went on a trip to Washington, D.C., correct?
Yeah. Yes.
And what was your focus there?
So we went to Washington, D.C. a couple weeks ago to meet with the Missouri congressional delegation to talk about the proposed rate cuts to the home health program. You know, every year it seems home care is in the, you know, has a target on our back, you know, for all kinds of things. But this year's no different. So when the Centers for Medicaid and Medicare Services came out with their proposed rule, it included a 9% rate cut to the home health program. It's a vital service because if you talk to most people, if they can receive care at home to get them through maybe an illness or after a hospital stay or something like that, they want to be home instead of going maybe to a short-term stay at a nursing home or extended stays in the hospital. So it's a very important, vital program for the community, and this proposed rate cut will definitely have impact on access to those services.
Could you help us read between the lines when you say trouble with access to services?
So what I hear from my members is this rate cut will be hard for them to keep their doors open. So we're looking at massive home health agency closures across the state, actually across the country. But in Missouri, you know, the past probably 7 to 8 years, we've seen a huge decline in home health agencies. And so access has been an issue, you know, for the past, 5 or 6 years. It's only going to get worse with these proposed cuts. And unfortunately, it's probably going to affect our rural, smaller agencies more than our larger kind of rural or urban corporate or maybe franchise type agencies. And that's probably the most scary thing because we already know that rural healthcare is already kind of in a crisis. You know, we've had a lot of hospital closures over the years and things like that. So folks sometimes are, driving 1, 2, 3 hours to the nearest hospital. And, home health is kind of a lifeline for them, especially coming out of the hospital. Instead of having to get in your car and drive 2 hours to the hospital or a doctor's appointment, that home health nurse can come in and really monitor your situation and kind of keep eyes on you to protect your recovery and things like that. And so if we lose that ability, families are going to be faced with either having to get that care somewhere else or just go without. And we're going to see that being probably a worse outcome because we're going to see an increase in rehospitalizations due to that, or even things more devastating.
So it sounds like rehospitalization would be a lot more expensive than trying to help somebody stay in their home. Did they give any reason why they want to make all these cuts?
Yeah, and it's very complicated. Back in 2020, the home health program was switched to a new type of reimbursement model. And that is the way the government sets up payment for home health services that a home health agency would provide to someone in the community. And it is very complicated. And there's a lot of nuances behind that rate, a lot of politics behind that rate, but they're saying that home health agencies make too much money. Their margins are too large. But every home health, if you talk to home health agencies, they're barely scraping by. So there's flawed data in what they're looking at. And that's our main purpose. And one of our main purposes for going to Washington, D.C. to, meet face to face with these legislative leaders is to tell them, these are the real stories. This is what's really happening out there. And with these proposed rate cuts, we are going to see agencies shut their doors. They just cannot afford to provide the care, and based on the reimbursement that they're getting. And so the whole access to care issue was the main point of our conversation in Washington, D.C. And Missouri is in a unique position because one of our congressional delegation from Southeast Missouri, Congressman Jason Schmitt, he is actually the chairman of the Ways and Means Committee, which is the money committee. So we were lucky enough to be able to take some provider constituents with us. And we met directly with him and had a great conversation. And my providers that went along did such a great job explaining what really is happening, in his district and just across Missouri in general.
Did he mention what were the challenges that he was facing to try to help mitigate this cut?
Yeah. And I think it's just like with anything. I mean, it's, even on our personal level, when you're trying to balance the checkbook and make sure you can pay all your bills and put food on the table and make sure everything's covered. And if, just depending on other mitigating circumstances, if one of those revenue streams or something doesn't come in for you, you have to start making those hard decisions. Well, what do I do without this month? And it's no different, I guess, on the federal level. It's just a much higher level of dollars we're talking about, but they have to prioritize. And I think that's why we take the time and they take the initiative to go to Washington, D.C. and talk with our elected officials and reach out in other ways, phone calls, emails, that type of thing, because we need to make sure they remember that we are important. And we are, like you mentioned earlier, hospitalizations is definitely a more expensive type of care. And if we can reduce the number of rehospitalizations, to us, it's kind of a no-brainer. Home care is one of the cheapest forms of health care there is.
It's scary. Now, we've had cuts in the past, and we've had potential cuts that they ended up not being the size of what they initially had planned. Is there any indication that we might see some relief from the amount of cuts?
There's no indication. I mean, the way the process works on those proposed rules is they have open comment period. And so, of course, us and a host of other advocates submitted many comments to CMS on reasons why they should not institute those cuts. So once that comment period kind of is open and then closes until the final rule comes out, you can't have conversations with them, to continue conversations and say, well, what are you thinking, or that kind of thing. So they're pretty tight-lipped on where they might be going. If history repeats itself, you're right. They may come out and say, well, maybe 9% is too much. Let's do 4, or 4.5. Let's meet in the middle or something.
Yeah.
But we also, through our national association, they actually had a bipartisan representation to file a bill in the House to actually pause the cuts for 2 years. So the national, was thinking, I don't know if we can put as much faith in CMS as we have in the past. So let's cover our bases and try, doing a comment period with CMS, meeting with our congressional delegations, asking them to put pressure on CMS to say, hey, wait a minute, let's look at this again. Maybe the industry's right. Maybe there is some flawed data that we're relying on. And then a bill has been filed in addition to that.
I know that they have what's called a cost report that they ask most, where all agencies that take Medicare are required to submit. And one of the things that we've always noticed that was kind of odd is that they never allowed us to include the cost of marketing in that data. Do you think that influences?
Yes, the cost reports have a lot to do with, because again, that's where a lot of the flawed data comes from. The cost reports, I think they even use, they pull out all hospital-based home health agencies, which we have plenty of across this country.
Yeah.
And so when you're not taking all of the information in account, then it's going to provide some flawed data. And there's a lot of, I think, education that needs to be done for agencies to complete those data. Those cost reports. I don't really want to say correctly, but more standardized, where the data is just not all over the place. So
if I didn't have a marketing spend, I would definitely be in better shape as a business owner by a long shot. So it just seems a little disconnected to not have all of the data in there when they're making their decisions. So let me just kind of switch gears just a little bit. So we talked a little bit about cuts to home health. Are there other major concerns going on right now in the industry? I'm sure everyone that watches any type of news understands a lot of the changes coming down from the federal level, one including the Big Beautiful Bill, which will impact Medicaid funding on the state level. So the federal government funds the state's Medicaid programs, but it's the states that make the decisions on where those Medicaid dollars go. So one big concern that we have with that is, Missouri is already predicting a budget shortfall for the next fiscal year. So they'll come together starting in January to work on the budget for the next fiscal year. And I think they're anticipating, like a $1 billion shortfall already. Oh,
so if you add that into the potential cuts that would be coming down in the Medicaid funding from the federal level, Missouri's going to have a hard time, I guess, deciding where they're going to divvy up those dollars, because there's not going to be enough to go around. There's nothing that has come out from the state that says this is what we're going to do. Again, they're being very tight-lipped. I'm sure right now they're just looking at all kinds of alternatives. But one of the things we're concerned about is the funding for our home and community-based services. So that would be more of your, like I talked earlier about, your personal care, your Medicaid programs, a consumer-directed program, or your in-home agency program, those type of things, mainly because they are non-mandated services. So, of course, if I was looking at the money, of course, I'm going to look at, okay, what am I mandated to do? And I have to make sure I fund those programs. And then where else do we spend those dollars that we may have to pull back from?
So in the first scenario with the cuts to home health itself, we're looking at potentially home health agencies closing their doors, and they're just not there to serve those patients. In this particular scenario, it's the funding that's being eliminated. And so we could have potentially vulnerable adults that normally are kept out of skilled nursing facilities, for instance, and that sort of thing, that will lose services. Has the Missouri ever gone through anything like this before?
Prior to my time here at the association, and this is just from what I hear, from predecessors and things, 1995, I think, was the big year where they had huge Medicaid cuts to the state, in addition to some Medicare funding for the home health agency. So we saw kind of what we're worried about now. We saw a lot of home health agency closures. And then we saw a lot of the Medicaid recipients receiving home and community-based services lose services. So we have lived through it before. The last 25 years, those type of Medicaid programs would get increases of 1 or 2% at a time.
Right.
And then in 2 years or 3 years, they would get a 2% cut. And then the next year they might get a 1% increase. And I've done charts before, and it literally is a roller coaster. So as a provider, I don't know how, you do that when you have no idea what your next year's funding is going to be. So the past couple of years, though, our Medicaid programs have received significant rate increases.
Yeah.
And so, but they played the catch-up game, because we needed some market-based rates. Workforce is a huge issue.
It is.
Probably any employer can tell you, and the home care industry is no different. And so trying to keep up competitively with pay for whether it's your nurses or your therapists or your aides or anything. And when you're competing with hospitals and nursing homes that have higher reimbursements and can pay their workers a lot more, it's very difficult in the home care field.
It wasn't that long ago that aides in this industry got paid almost half the amounts that they're getting paid today on average. Yep. And so it was a welcome, change where when they offered the increases that we could increase and what basically happened is that we increased, pay to our staff, and a lot of agencies did the same thing because we were all competing for the same workforce that just kind of wasn't there. And, we were competing with all the other industries that were raising rates as well. So it came at a great time. And the wonderful thing about it, I think, was that we could see in the community where we were really impacting people who normally weren't receiving services, not because they didn't qualify, but because there just wasn't an agency that could staff it. And all of a sudden, they were on a roller coaster going in and out of, or merry-go-round, more or less, going in and out of the hospital or skilled nursing facility. And we were seeing a lot of people who really didn't need a skilled nursing facility. Right. But it was really the only care that they could get. And, the way Medicaid structured, where they'll pay for, it's like one or the other. They'll pay for home care or they'll pay for a skilled nursing facility. And there's lots of steps in between. And now that they're considering, these cuts and that, the home-based care is not mandated, and that might be the first thing to get cut. I'm just afraid that there'll be a lot of people that end up, not in a great situation. And that's what we want to kind of dive into a little bit more today, is to talk about what things some people could do to prepare for these cuts.
If you ask somebody, would you rather, be able to stay home and get some care or go to a nursing home? The higher percentage of folks are going to say, well, I'd rather stay home. And the home care services in Missouri are set up where, to qualify for them, you do have to meet nursing home level of care. So if they're like, okay, yeah, you need, you meet the nursing home level, but how about we give you that care in your home? And, I know I would want that, to stay home with my family, in my community, things like that. So that's the message we really try to get across, is that most folks want to age in their community and in their home. Now, I'm not saying nursing homes, there's no need for nursing homes, because there are. There are cases where, families just cannot handle that, or for whatever reasons, or they're just too medically complex. They do need that 24-hour care. Yeah. But it's it should be about choice and where you want to receive those services. And I think during COVID, it really heightened that, because while home care, I don't want to say flourished, because we had just as much problems with staffing and things like that, or people that, no, you're not going to come in my home and, do the care here because I'm scared of COVID. But, we all saw with the nursing homes where, no one was allowed to visit. They weren't, we learned some really hard lessons, I think, through COVID. And I think one of the things that came out of that was home care stepped up to the plate. We were able to fill some of those gaps in care that the hospitals couldn't, that the nursing homes couldn't. And, we were hoping that would elevate us a little bit higher in the eyes sometimes of policymakers or legislators and things like that. Because my goal is that I want, when anybody talks about healthcare, I want home care to be a part of that conversation, because we are just as much a part of healthcare as hospitals and nursing homes and doctors and, things like that. So yes, the access to care, that again, it all goes back to access to care that we're worried about. If we reduce funding for services, the access to care is going to get worse, or there will be, there just may not be anything available. We've already seen, and I know we mentioned some of the recent increases in rates to providers and things like that. But again, that was really to play catch up. And really, like you said, just to be able to hire a workforce, because not only were we competing with nursing homes and hospitals for the same folks, we were competing with Walmart and Target and Starbucks. They were paying workers a lot more than the home care agencies could pay. Yeah. And, I don't know, maybe working, at McDonald's or something would be probably a little bit more glamorous than sometimes the personal care that we have to provide to, the bathing and things like that we have to provide. So, home care is not a glamorous career, but it's a very rewarding one. So yeah, trying to kind of bring all this together with, it's very important. Most people, I think I just read something the other day, the National Association put out a results of a survey that said, like 80% of people surveyed said they want to be able to receive care in their home versus having to go, somewhere else. So we know it's important to community members. And that's the message we try to get across to our policymakers, to our legislators, things like that. Yeah. Because again, much cheaper than hospital care, much cheaper than nursing home care. And if it can be done and done properly and the outcomes are better, again, I go back to, it's a no-brainer. But sometimes trying to convince those in charge of that is a little more difficult.
Yeah. Well, and I think that let's dive into the dollars and cents of it just a little bit, just so people kind of have an understanding of what we're talking about, because we're talking about it being less expensive. So let's, most of the time we're talking, home care hours per week of somewhere in the ballpark of 10 to 15 hours. And just to keep the math simple, that's, 300, based on what their rates are right now, it's about $320 for 10 hours a week, $1,200 per month. So I'm simplifying things a lot here, but when you're talking about a skilled nursing facility and what Medicaid covers is somewhere in the ballpark of $6,000 a month, and there's no in between. And, now they're talking about cutting something that's not necessarily required because that's just how things are set up. Right. And when you're talking about there's great nursing homes out there, they will all tell you there are not enough beds for all the people who are currently getting services in their home, that if they're qualifying for nursing home level care and they don't get that care anymore, that's where they need to go. And so it's going to create this issue where you could have waiting lists where people, and in the meantime, they're going into the hospital, maybe hitting, the skilled nursing facility as a rehab and can stay there for a short period of time potentially. But then they're back home again. They get into crisis, and this this retread. And now Medicaid is on the hook for all of these hospital stays and skilled nursing stays and all of these people that normally stay in their home. And so in the process of making these cuts, I'm afraid what they actually are doing is they're going to be investing a lot more heavily in other areas of healthcare when initially they were trying to balance a budget, and the budget gets kind of blown out of the water because there's all these extenuating circumstances that go on with all this. So
that's exactly right. And just because they don't cover the services doesn't mean they still don't need the care. We ran into that a couple years ago, maybe I can't remember, like 10 years ago, when I mentioned earlier the nursing home level of care, that you have to meet that threshold. There's a algorithm test to do that. When they wanted to cut some of the funding for that, they just upped that number that said, well, instead of a 20, now you have to be a 24 or something. And so it cut a whole bunch of people off qualifying. Yeah. But again, it doesn't, just because they cut that, raise that number, doesn't mean those people that were on services just magically didn't need care anymore. Yeah. So it starts a snowball effect, and the hospitals can't maintain, their reimbursement isn't sufficient either. They have staffing issues. Nursing homes the same way, workforce is everywhere. So it is a kind of a unique challenge. But again, I kind of go back to, well, let's use some common sense here. But sometimes that's where the fail is, I think.
Well, one of the other concerns that I have is when you mention that, there are going to be agencies that decide to close their doors, there'll be a lot of them also that sell to like private equity groups. There's tons of interest in this right now. I don't know how much the interest there will be once they make these huge cuts. But you could see there being a bit of a fire sale going on with people trying to get out of the industry, and then being picked up by private equity, who unfortunately has not gained a great reputation for putting care of the patients first. They oftentimes are very focused on trying to extract their initial investment within a 5-year window. And that creates this whole other issue with, that if the quality, if they could still have services out there. And so the people who are left who can still get onto services may be left with an agency that is not focused on making sure that they're getting the best care.
Businesses, they have margins to meet, and they have businesses to run smoothly and things like that. And that's where I think it gets hard, because we are seeing a lot of the kind of not-for-profit, public health, hospital-based, agencies kind of going away.
I'm a perpetual optimist. I think sometimes things have to get much worse before they'll get better. And as a provider, we're going to have a front row seat to some of this. And I don't blame the business side of healthcare necessarily. I just, people need to understand what the motivation is. If you have a small mom and pop in an area, they're going to care more about reputation and providing good care because the leadership lives in the town that they serve. And these large, healthcare companies, they're beholden to their shareholders. And so the motivation is different. The focus is different. And that's why, this coming down the pike, we want to try to inform as many people as we can so that, if they have a loved one who's, older and looks like they might be a candidate for going on to Medicaid or are currently receiving these services in their home, they really need to start reaching out now to their representatives to start that conversation. So speaking to that, what level should they start, or is it all levels?
Well, and that's a great point, because advocacy is, not just for folks like me or, a paid lobbyist or just an organization. It's for those in the community, to their elected officials. So, for those in the community, they need to start reaching out first on the state level, because as I mentioned earlier, the states are the ones that decide where the Medicaid dollars go. So that type of funding needs to be done on the state level. And I know a lot of, and even, some of my providers that I talk to, and I say, hey, come to the Capitol with me. Let's go have these meetings, with the budget chair or something like that.
Right.
Or let's testify at the budget hearing, They're like, oh, no, I can't do that. They're intimidated by it, but they shouldn't be. Those folks there are your elected representatives, and they're there to help you and listen to your concerns. And as long as you remember that and go in and just have a honest conversation with them about why this issue is important to you or what's happening to you, because those personal stories, and especially from their constituents, it makes all the difference in the world.
We have an impact. We really, really do. And these representatives are human beings just like everybody else. And yeah, there's alignments and, fallen party lines and all that stuff. But if the whole party is getting this information, they're going to look at it and hopefully, look at other data numbers to see, how the impact of this really goes.
And we've found that home care services, whether it's Medicare, home health, hospice, Medicaid, anything, it's a bipartisan issue. We've got support from both sides. And so don't ever let that scare you either, because, we have found when you do the one-on-one conversations with these folks, they get it. Most of them have had family members that have needed, some type of service. And, I always joke when we go to Washington, D.C. and you go in and their interns are so young, I feel, they're like, are you even 20? They're so young to me. And so I kind of have to change my story up to say, well, has one of your grandparents ever, had a surgery and needed to come home and needed some physical therapy and, things like that. So you can usually find most people have been touched in some shape or form by some type of home care.
Speaking of that, do you have a personal situation in your own family that you've had to deal with in the past or currently?
I have. And I think that helps me in my passion for what I do, because I have seen the benefits of it. And we have used both home health and hospice in my family. And, I am wholeheartedly a believer in those services. And not only does it help the patient, but it helps the families. Yeah. And to see that possibly go away, that's why we continue to push and do what we do, because it is such a vital service.
We were talking with Mark Applegate from Senior Age in one of our first podcasts, and he was talking about having to travel across country with someone with dementia. And you don't just hop in a car and drive for 10 hours. That's just not how it works. And the challenges that some of these families have to overcome. And again, this is where home care comes in, just the fact of not having to pack someone up and put them in a car and potentially exhaust them and, all the time and energy that it takes, and have a nurse or an aide come to the home. It's just such a huge relief for some of these folks. And so, that's a great point. And I'm so glad that you're connected to those people.
I don't want to always just focus on, the money and stuff like that, but the regulatory burden that has happened over the last, continues to happen, is another, I think, factor that affects agencies, because especially our small, like you said, your mom and pops that may not have the staff that they can devote to always follow, making sure every regulation policy is covered, because there's so many, and there's so many documentation policies and requirements and things. And probably one things I hear most from my nurses is, when can I just go back to providing care?
Yeah.
That's why they got into nursing.
Yeah.
It wasn't to do 4 hours of documentation in the evening and things like that. And so, that's another issue, I think, for the home care industry, is sometimes that over-regulatory policy burden.
I totally agree. I think so much of it's related to regulation. And it's such a big behemoth, so to speak, that, they have teams of people that are working to try to figure out how to make, this insurance agency, insurance company more profitable to serve their shareholders. That is their job. We want to criticize that, but that's exactly who they are. And, I think some people are just shocked that, that these big corporations are going to focus on, money, but that's what they do. And, we just have to wrap our brain around that and understand that the only way that we're really going to solve this is through regulation. And as much as some people might say, well, we shouldn't have to rely on the federal government or the state or whatever. And there's a degree of that maybe this will force us to say, people need to look to their communities. They need to look because there are services that are in their communities that we can try to uncover. Senior Age is one. They have all kinds of other services that people don't take advantage of that they could potentially. There's things related to the Alzheimer's Association, and we just had a podcast with an elder law attorney about protecting assets and trying to and on our side as a provider, we're looking at this going, okay, they just made the parameters, the questions that they're asking for recertification onto home-based services a little more difficult. And so with that, we want to look at these folks and go, how did they answer that question? Because I will tell you, as a physical therapist, I've been in people's homes and, I'm like, okay, how did you get to the bathroom? And how did you, can you walk? How well are you walking? And they're like, I'm walking great. And they're like, well, let's stand up and see. And they're not nearly doing well as they say they are.
That's funny because when you asked me if I, had any personal experience with home health, and I did, because my dad had some abdominal surgery at one point. And so, of course, not in the hospital very long. They discharged pretty early. And so I spent the first night with him, and of course had to get him up a couple times. And he wanted to stay in his recliner chair, didn't want to go to bed, and needed to get him up a couple times. So it was a chore to do it. He was a bigger, kind of person. It was hard for me. And he kept wanting to get up. And I said, why don't you just, if you don't need to get up, let's just, rest or something. And home health was coming the next day to do their assessment, their OASIS. And he kept saying, no, I have to be able to get out of this chair. And I said, why? And he said, because if I can't get out of this chair tomorrow when the nurse comes, they're going to put me, she'll want to put me in a nursing home. He said.
Boy.
So in his mind, he was thinking he had to prove that he was capable of staying home without and getting up out of a chair by himself. And of course I had to laugh because I said, Dad, well, first of all, the home health nurse is probably the last person that would ever want to put you in a nursing home. But, he just wasn't educated on that type of, how the system works. And sometimes I think it's a generation. The certain generation is very proud.
Oh, yeah.
And you're right. They may not understand that they're actually hindering, some type of services or care that they can get because, that's just the way they were raised and brought up and things
Absolutely.
like that. So there's a lot of things you have to think about, and look at when you're assessing and things
It's
like that.
so true. A lot of times I'd have to be a detective to try to figure out if somebody was actually in pain. You get some guy, it didn't matter, guy or gal, at a certain age, the older, the greatest generation, and they will not complain. And then you're like, well, show me how you do this. And they can't lift their arm. And you're like, okay, there's something there. Let's dig in. I mean, and, you'd finally just pull it out of them that they were probably an 8 out of 10 and they'd been that way for weeks. And you're like, oh boy, this is, and trying to help explain, breakthrough pain to them and, how if they stay on top of it and, they need to complain, they need to be honest, because that's going to, we're not trying to take away people's independence. We're not, we just the opposite, actually. Right. It's just safety is such a major thing. And, all it takes is one bad fall, and, or, they're taking the wrong medication the wrong way and they don't have anybody supervising that at all. And it just gets out of control. And then pretty soon it's a lot more serious and they have sometimes permanent damage that could have completely been avoided. So, there's already those challenges without all the cuts that we're talking about,
Absolutely.
And more people in these people's lives are the better, in my opinion, like they, even if they have home care and it's just very limited, just having somebody in the home to identify problems. So we have aides all the time that reach out to us and identify, it's like, oh boy, this is going downhill fast. And, they don't have family in town or the family is super busy. And, some people, if they rally when families around, they can walk better. They're stronger for that 15, 20, 30 minutes or whatever. And then they just collapse after they leave. And so it's just one of those things where, we just need all hands on deck. And so we've got to fight these cuts.
Yeah, absolutely. And so, again, going back to whether you're someone receiving services or you've got a family member or your neighbor or, whoever, it's important that everybody understand. And, eventually it's going to affect you and me. I mean, yes, I'm hoping home health will still be around, but, if I ever needed the service and that's what worries me, and my predecessor, who was the executive director here for 29 years before I took over. And I still, talk to her and run into her periodically, and she'll say, well, what's going on? And I'll tell her, and she said, I'm not worried. Home health always seems to somehow bounce back. And so I've tried to have her optimism. But when I see some of the effects of these cuts over the years and some of the long-standing kind of historic home health agencies that are closing, and they're not small, they've got resources and things like that. It does worry me, a little bit. So I don't want to just tell everybody, oh, we'll bounce back. We always do, because I think, like you said, we may have to hit rock bottom before they ever understand, which I think is unfortunate, to always be reactive, instead of proactive. It's like, why do we need to hit rock bottom? Why do we need to go without services to find out, oh yeah, actually it was better when getting those services, and I feel like that's where we're headed again. So,
but this podcast is really going to help getting that out there and people getting introduced to you and just the things that you've said today is very powerful. I think a lot of people are going to hear that. One final question. How did you get into this?
Well, I actually have a degree in criminal justice. I was one of those kids who didn't know what she wanted to do with her life, and that just sounded like a fun thing to study in school. And I actually started, how just opportunities come up and you're like, well, I need a job. And there wasn't much around this area in the criminal justice field. So I started working for a different association. It was the Dental Association. So I started in association work and worked there a couple years. And then I moved to at the time, it was called the Missouri Association of Homes for the Aging. And so it was the Nursing Home Association that represented the not-for-profit nursing homes. And then from there, 15 years there, and then I moved into the home care. As I mentioned earlier, my predecessor, Mary, was getting to retire. And so I moved into her role as executive director here. So I've worked in dental, nursing home, and now home care. So they're all very different.
Well, well, we're very glad you're in the position that you're in, and as a member of the Alliance, I have to say how grateful I am for your advocacy, and we will try to share some stories as we go through this. We have a lot of success stories that we get to run into, people who were really struggling, and we got to take care of them and that sort of thing. And I think it's important for you guys to hear about those. And if we run into other people who might be interested in helping in your advocacy, actual patients, we will definitely pass that on. And any other agency out there who might be listening, please join the Alliance. Please help Carol and the Alliance help our industry by helping us. They're helping our patients and our clients. And so, again, thank you again, Carol, for everything you do.
Great. Thank you. Appreciate you.
Spencer, what do you think? Carol's amazing, isn't she?
Absolutely. I learned so much from her, and learning about the politics of all this, especially with possible $1 billion shortfall in Missouri, and that there's going to be some 9% cuts. So kind of diving into that was pretty interesting.
They've done this before. And so I'm trying to stay positive about this, that they'll pull that back a little bit. There probably will definitely be some sort of cut. But I do think they've been inching that away. We've been losing a lot of locally small mom and pop based agencies left and right across the nation, not just in Missouri. And so it is something that we have to keep our eye on. We are not peaked at the number of elderly that are aging out into the Medicare world. Like the baby boom is still in mid boom here. And so we have a lot more people who are potentially going to need care in the next 5 to 10 years. And as a healthcare industry, cutting is not probably the answer. And I understand, like, we need to make austere and be very careful. And, we could get into the weeds on different ways in which they could control costs. I personally think there needs to be more hands-on physical inspection related to billing. If there were more proactive surveying that zeroed in more on billing practices, making sure that people who are on services qualified for those services, that sort of thing, I think that would go way further. There's $1 billion in there, I guarantee it. And what they've done is like, we're going to penalize everybody across the board. Even, ethical, do the right thing agencies are unfortunately paying the price for companies that have not been doing it the right way. And I'm not saying that's widespread or anything, but there is definitely a component of that. And I wish there was more involved with managing that part of it, rather than just an arbitrary cut across, the entire industry.
I'm just happy that the Missouri Alliance is up in DC actually advocating for all of us, because we really need their help to kind of cover these issues, because we don't want that clean slate. They need to actually go in and look at that budget.
Definitely. For sure. For those of you out there and we're putting a bow on things right now, there's some things that we've covered so far. If you're caring for someone and you're worried, make sure you're making, an appointment with an elder law attorney. Sit down with them. Most of them won't charge for an initial consultation. You can get an idea of all the things that you want to start kind of make sure you're putting in place. If you're worried about a loved one and you're trying to care for them at home, try to get a hold of Senior Age, or, you can also look at what the next level of care is, assisted living, independent living, that sort of thing, trying to see what those options are. Not that you have to make a move right now. A lot of times it just makes you feel better to put those plans in place. So I really hope that over time, as people listen to this, they will start seeing how some of these pieces fit into their own life. Or, if it doesn't affect you, then send this to a family member or a friend that you think might be dealing with the same thing. Because it's really important that we try to spread this message. And even if they're not in Missouri, it doesn't matter. They need to hear this regardless of where they live, because I promise you, they're dealing with the same things. The other thing is, we could ask if you like and subscribe to the podcast. It really does help the algorithm, and it puts us in front of other people so that, this information can get out there as much as possible. Information is power, and we really hope that people will tune in.
That's right, John. And if you have questions for us, email us, questions@ingoodcompanypodcast.com. We would love to hear from you and hopefully get some good experts in here that can answer those questions for you. So again, don't forget to like and subscribe. It's very important for us, and to get this information out to people who really need it. If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company Elder Care in Your Backyard. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.